So this is something that I don't think I've ever said before. According to a national health nonprofit, the nation's supply of COVID-19 vaccine is set to outpace demand in the next 2 to 4 weeks. State health officials, of course, are pivoting from managing a flood of interest in the shot to trying to convince the people who haven't had it yet to get it.
Wow. That's like when we said there's plenty of toilet paper.
Right?
Yeah.
I know. I almost went and bought like a truckload from Costco.
Which you can probably do now.
I'm going to need all of it.
Paul Seegert is monitoring this at PCS Advisers, an employee healthcare benefits consulting firm in Northern California. Good morning, Paul.
Good morning.
So getting to herd immunity seems to be the goal here, but there seems to be a lot of people uninterested in still getting the vaccine. And why is that?
Well, we're down to about 1 in 4 that are saying they will not get the vaccine. And I think it's because of mixed messaging. We've had folks that not too many months back said it wouldn't be safe, and now they're telling everybody to go get the vaccine. So unfortunately, I think we're victims of our own politicization of this whole situation. But we do have a vaccine hesitant population in general. It's usually higher than that. For other vaccines, it's around 30%. But I think there's also good news to share, and that is that according to the CDC's own research, 8 times more of us have had COVID asymptomatically than confirmed cases, and it does provide the same kind of immunity as getting the vaccine. So those that are hesitant aren't going to stop us from reaching herd immunity, fortunately.
Oh, okay, so now we're about to have plenty of vaccine. The deal is, though, I mean, it has an expiration date, correct? How long can we store it before it goes bad? I would hate to see it thrown out.
Yeah, I think what's going to happen, we pre-bought so much between us and other Western countries, Europe and so on. We bought 4 to 6 times more than our populations, respectively, because we didn't know which were going to come through, and then it's turned out, there's been a lot of success in creating these vaccines. And it just came out this week. We're going to donate 60 million doses, I believe, of the AstraZeneca vaccine to some other poorer nations. And I think we'll start to see some of that happening.
And some people say, well, I don't know which one's better. Is it Moderna? Is it Pfizer? Is it J&J? I mean, to you, are any of them, better, worse, or are they equally okay?
I think the first available would be what's recommended, although the J&J, of course, was on pause because of the blood clotting. AstraZeneca is built in the same way as the J&J, and they had many more instances of that in Europe, not a higher rate. They used it a lot more than we did. So it may be that if you were a younger woman, it might make more sense, or if you were concerned, it might make sense to opt for one of the others if you could. But it's good to keep in mind that those adverse reactions are about 1 in a million in terms of the clotting, so it's very unlikely. You're twice as likely to get hit by lightning as have an adverse event like that.
Okay, and that's a pretty rare event as well. So now, if you're the medical establishment, how do we convince people, hey, listen, when this thing is available, get out there and get it? And more importantly, we're hearing that underserved communities are still not getting vaccines. Why?
Yeah, I think there's distrust there, and our mixed messaging contributed to it. You're right. If you look at L.A. County as an example, they're actually doing very good right now. Less than 1% of people tested are positive, but they have a lower, and that's despite having a lower vaccine rate than the rest of the country. 37% of their population has had one dose. More than 50% of the country as a whole has had more than one dose. And if you look at the subsets of the Black and Latino populations in LA, they're at 19 and 17% who've been vaccinated. I think we just need to give people the facts. There are adverse reactions. They're very, very rare. If we were to vaccinate the entire country, 5,000 people would have a serious adverse reaction that could result in death. But if you look at the numbers of people that have died from COVID and the small percentage of our population that could affect, it's a very small, way to the right of the decimal.
All right, Paul Seegert, PCS Advisers, thank you so much for joining us this morning. Very interesting information.
Thanks for having me.
All right.